make a swift start to the event. So I just want to say hello and welcome to today's Sport Medicine and Performing Arts Medicine Open Day. Thank you so much for joining us. My name is Kate Thomas. I am the Events Officer for the Faculty of Medical Sciences here at UCL and your chair for this event. We're hoping this session will address those course-specific questions you may have and will help you to gain an insight into what it is really like to study on our exciting MSc programmes. I'm delighted to welcome today's speakers, Hara Truly and Courtney Kipps, who will provide you with a summary of our Performing Arts Medicine and Sports Medicine exercise and health programmes. There will be a Q&A session and plenty of interactive opportunities for you to join in throughout today's session. Just to let you know, this session is being recorded and will be made available on our website following today's event. We're here to respond to your questions, so please share those throughout using the Q&A function on Zoom. So now to introduce our speakers, we have Hara Truly. Hara is a medical doctor with a background in musculoskeletal medicine and a graduate of the MSc in Performing Arts Medicine at UCL. She has been the course leader of this course since 2015. Dr. Truly is also a clinician for the British Association for Performing Arts Medicine, and she also works in dedicated musicians' clinics. In Hara's presentation, she'll introduce you to the field of performing arts medicine, the international organisations that are formed to provide education, research and clinical services to performing artists, and the role of UCL in starting and continuing this unique postgraduate programme for the past 10 years. And Courtney Kipps. Courtney is a professor of sport and exercise medicine and co-lead of the MSc programme in sports medicine, exercise and health at the Institute of Sport, Exercise and Health at UCL. Professor Kipps will be presenting a short talk on why you should seriously consider studying for an MSc in sports medicine, exercise and health at UCL, if, like himself, you're passionate about sport and exercise and medicine. So before I hand over to you both, we have a very quick poll that we would like to run and just find out a little bit about our audience today. So I'll just launch that. So hopefully you should all see a poll on your screen now. So we're just particularly interested in finding out what course you are interested in applying for. And please don't worry, if you're not sure yet, please do equally let us know. That's really helpful for us to know, particularly for the Q&A part of today's event. Great, and we thought actually, whilst we're getting you to submit your answers to our polls, if you would like to, and we would love to encourage you to do this, if in the chat you can just pop down a bit about your background. So perhaps your background, what jobs you're doing at the moment, or perhaps your academic background, just to let us know a bit about you today, and perhaps we can then tailor the content of today's session around you more so. So please do feel free to pop your answers to that question in the chat. You should be able to have access to drop a bit about yourself, and please feel free to introduce yourself and tell us a bit about you, and that would be great. Okay. So I think we're waiting for a couple of more answers on our poll. So I'll just give you another 20 seconds or so. Oh, fantastic. I can see that we have medical officer, orthopedic background, international medical graduate. Okay, fantastic. Great. Well, we do have a Q&A part of today's event, so we will just keep putting everything in the chat and the Q&A function, and we'll definitely come to that after the presentations. But thank you, Shoaib and KJ, for your answers. Oh, and thank you, Chloe, Master of Piano Performance. Fascinating. Fantastic. Okay, great. So I will just end the poll now, and hopefully you should all see the poll results on your screen now. So we have a mixture. So 22% are interested in the MSc Performing Arts Medicine, and 78% of you are interested in sports medicine, exercise and health. And none of you are not sure yet. So it's great. We definitely know we have an audience that knows what they want. So that's fantastic. Okay, great. Well, hopefully that sets the scene well to hand over to Hara. Over to you, Hara.
Thank you very much, Kate. Thank you for introducing me as well. And a big welcome to all of you, those wanting to do the Performing Arts Medicine course, and of course, everybody else who is bidding for the Sports Medicine course. Bear with me a moment, I'll share my presentation. Okay. Can I just confirm that you can see my slides, Kate?
Yeah.
Great, thank you very much. So Performing Arts Medicine, and I'm sure for those of you who are listening to us this afternoon, some of you may not have heard much about Performing Arts Medicine, and indeed it still remains a lesser known field of medicine. I suppose I would place it chronologically where sports medicine was possibly 20 years back. We're still in the early years of this field, and I'm personally hoping, and I'm sure you will understand why, this field to increase the interest of our colleagues in the future as well. So here at UCL, we're very lucky to have this program. It is a unique program. It is the only program at this postgraduate level reaching up to a master's degree. But as you can see on your screen, we have a master's, which is the MSc. We have a postgraduate diploma and a postgraduate certificate. And we belong, like the sports medicine course, to the Division of Surgery and Interventional Science at UCL. I'm trying to change my slide, which I don't seem to be able to do. There we go. As I introduced, Performing Arts Medicine, PAM for short, PAM, is a unique specialized field. A lot of professionals in the healthcare industry can study, can learn about Performing Arts Medicine. I have just listed most of the professionals that deal with this field of medicine. So medical doctors like myself, in this country, in the UK, we have a number of GPs as well who are very much interested, but equally medical doctors from other specialties as well. We have biomedical scientists in people who have graduated from sports science or another biomedical science, biology, for example, physiotherapists, osteopaths, chiropractors. We have had a number of sports therapists doing our courses. Those of you who may be coming from further afield, we have athletic trainers, kinesiologists from the US and Canada courses. We have also psychologists, speech and language therapists. We have dance and music scientists, and very recently we have also added performing arts educators. And I saw Chloe on the chat there. She has graduated from a piano performance. So somebody like yourself, Chloe, you can ask me a little bit later. We would assess in a different way and for perhaps one of our programs. And we look after everybody who can be on stage or on screen, like musicians, dancers, circus performers, singers, actors, but also everybody who is behind the scene. So we would offer services to crew members as well, of whatever setting that may be. Performing arts medicine, thankfully, is a global field now. We have a lot of colleagues around the world, from the Far East to the Americas, Australia, Europe, who are studying, some in bigger courses like ours, but also in smaller courses, and they gain knowledge and some experience in performing arts medicine. And as I mentioned at the beginning, UCL remains the only institution to have this degree at a master's level, the Performing Arts Medicine degree. I'm introducing you here just to give you an idea of what's going on in the world. These are I would say, the four most important associations that deal with performance medicine. The IADAMS is the Dance Medicine Society. It's an international association here on the top left. I'll just use my pointer here. I hope you can see it. This one here is the BAPAM, the British Association for Performing Arts Medicine. I'm not going to talk about these associations. I'm just giving you an idea of what is already there. And these are associations that are up and running for a number of years now. ASPA is the Australian Society, and PAMA is probably the biggest of all. It's an international society. It's based in America, and a lot of us and most of the health professionals that work in this field, we are members of this international society. And you can see here the next symposium is about to happen in July in New York City. And there is background literature that one can have on the shelf or borrow from our libraries if you visit UCL and come here as a student, of course, or you can buy yourselves quite some interesting books for all genres and all specialties and all disciplines in performance. As you can see on this slide, voice actors, musicians, dancers, circus performers here on the right as well. Circus medicine is really increasing in recent times as well. And these are some of the journals where you may find scientific and peer-reviewed articles. The one at the top left, Medical Problems of Performing Artists, the MPPA, it's an American published journal. This is probably, I would say, the most common source of articles one would go to for this kind of issues. But other journals like the Journal of Dance, Medicine and Science, the British Journal of Sports Medicine publishes some of the articles on performing arts medicine, particularly in dance and circus. We have the Voice, Journal of Voice, the French Médecine des Arts, Frontiers, which is a big publishing company. We have some publications there and some journals on occupational medicine as well. And coming now to UCL and the programs, I'm not going to go into deep detail. Of course, you can find more detail if you contact us. But just to give you an outline, we have those 3 programs. The certificate is a 4-module program. It's all online. It's a distance learning program. You can do it in 1 year or 2 years. And then we have our diploma, which is an 8-module program, mostly online. And then we invite you to come in for 2 residential weeks on campus at UCL. And then, of course, we have the master's degree, which I would tend to say it's the most popular program. That's what most of our applicants choose. And it has the 8 modules that we have on the certificate, but we also have added 1 dissertation, 1 research project on this master's pathway. And again, most of it, the taught aspect is online. The residential weeks are again at UCL. We borrow some space at the Institute of Sport, Exercise and Health, and I'm sure Professor Kipps will tell you a little bit more about that. And we go into a research project as well for 60 degrees. And the diploma and the master's programs can be completed in 1 year, part-time in 2 years, or if you want a little bit more flexibility in your studies, then that can go up to 5 years. And we always start in September, the academic year. In terms of modules, we have 4 modules that all programs have: psychology, science of dance and music, voice, professional voice, the clinical management, and environment and lifestyle issues that have to do mostly with traveling and touring. So certificate, diploma, and masters will have those 4 modules. If you are doing the diploma or the MSc, you will have 4 more modules. 3 of them are quite clinical, and a research methodology that prepares students for appraising literature and also for writing up their dissertation if they are on the MSc. And as I mentioned earlier, the masters, the MSc, will have a research project with a dissertation for a full 60 credit there. We don't have any optional modules on these programs, and if you are a health practitioner, I beg your pardon, you can upgrade. So if you have entered at a certificate level and you find that you would like to have a little bit of an upgrade and go into a diploma or maybe an MSc later on, we have a mechanism that we can upgrade you, and during your certificate studies we can place you at a master pathway. In terms of teaching, as I said, most of the teaching is done online these days. The online teaching started with the pandemic, but we have kept it. We have been able to cater for applicants from further afield, overseas. And this is, I think this is quite an achievement to have been able to teach students that couldn't come to London for a while. We have about 25 to 30 hours teaching time for each module. The lectures are recorded and they're offered between October and March. So now in a couple of weeks, we're about to finish our 2nd term for this academic year in terms of online teaching. There's plenty of independent learning to do. We offer material content for independent time. We have weekly forum discussions on the lectures that have been given, and we also have some scheduled live sessions online. And as I said, the 2 residential weeks for the diploma and the certificate, and I beg your pardon, the master's groups, this is usually in April or May. This year is going to be on the 9th of May. And during those weeks, we have some practical work, mainly on examination of our performer patients. We visit some clinics, we visit performing arts venues, we have some practical examinations, we do some, we call them PAM rounds, so we all get together and discuss clinical cases with some of our colleagues as well. And of course, we have some social time to get to know everyone and help you carry on with your career after UCL, if we can give you some advice as well. In terms of assessment, again, we have some diversity there. As you can see, we have essays online, we have presentations online, we have some live presentations for the people who come to the residential weeks. We have some blogging, we prepare infographics, and we have assessments on critically appraising the literature. We have clinical cases to review. We give papers out for a week for the students to review the cases and give us some clinical judgment answers. And we have what we call the OSCEs, the Objective Structured Clinical Examination sessions. These are our practical sessions that the people who will come on the residential weeks will be examined with. And of course, we guide you through all the necessary preparation for that. And finally, we have the research dissertation, which is for the MSc only, and the students will write a long essay of, it is about 10,000 words. We have shortened it in recent times to between 7,000 and 8,000, depending on what the students will do. It can be a literature review, it can be original study, or it can be both. There are various formats that we have put together, and we will offer them to you, of course. And you write this up, and at some point we also have a viva and a oral presentation on the research study. In terms of entry requirements, who can come and study with us? For the diploma and the masters, we try to ask you to have the clinical scientific background that is required. Otherwise, people would probably struggle a bit if they haven't had this previous experience and education. So we're looking at medical qualified candidates, physiotherapists, osteopaths, chiropractors, nurses, sports scientists or biomedical scientists, athletic trainers. With the certificate that was introduced sort of halfway through the life of this program, we also have all the above, of course, applications looked at, but we also have offered the certificate to psychologists. Quite a range of psychologists are interested in performing arts, health, mental health issues, speech and language therapists, equally voice people that work in the voice clinics, and some candidates that come from the performance science or the performance education degrees as well on their undergraduate studies. So for those that are applying for the certificate and come from these backgrounds, we will probably need to have some kind of one-to-one meeting to understand their wishes and, of course, to assess their experience. In terms of careers, we will, as you understand, we will go in depth in all these issues that we look at in performing arts medicine. You will hopefully get the specialized skills and be able to work on your own in your professional practices. There are performing arts clinics. Some are completely independent. They can be in-house clinics in music, dance, and circus colleges in the working with the students. You can be in-house professionals in orchestras and dance companies or even musical theatre companies. Some of our graduates work in sports medicine clinics, working with perhaps circus or dance performers, and some of the circus companies, the bigger circus companies and schools have in-house clinics as well. You could, of course, become an educator if that's something that you like in performing arts medicine, or you can carry on with research. And we do have a pathway and advice of some of our graduates if they want to continue with a PhD. So I think that's mostly my overview of the program. I would love you to come and get in touch with me. The emails you see here are our generic one at the top and my personal one underneath. So feel free to get in touch, and I would be more than happy to answer any questions later on.
Fantastic. Thank you so much, Hara. And I will now hand over to Courtney Kipps for his presentation. Over to you, Courtney.
Good. Can everybody hear me okay?
Yes.
Excellent. Okay. Thanks, Hara, and thank you, Kate. So that's who I am, and of course I'm here to talk about sports medicine, exercise and health. And as Kate rightly said, this talk should be rather titled, Why I Think That You Should Seriously Consider Studying Sports Medicine, Exercise and Health here at UCL if you're passionate about sport and exercise medicine, like I am, and like the rest of our staff are. So I'll tell you a little bit about it, about the specialty of sport and exercise medicine, what you can do with your degree, what you will learn here, why you should consider UCL, and what you might do next. So the specialty is a genuinely multidisciplinary specialty. It is a mix of physios, doctors, sports scientists, sports therapists, rehab therapists, strength and conditioning coaches, podiatrists. We're all there working together in a sport and exercise medicine field. And so we all learn together in our teaching, and osteopaths and chiropractors, and there'll be some others too. And so our teaching is there for everybody. It's a very clinical based teaching. We're teaching you about the injuries and how to manage injuries. And there's some modules on exercise physiology, on research, etc. too. I'll come to that in a little bit. But more specifically about the specialty, we all have our own discipline associations. Doctors have BASM, physios, ACP, SEM, BASRAT for rehab therapists, BASIS for sports scientists. But I want to remind you that we genuinely consider this a multidisciplinary team and therefore a multidisciplinary course. Although it says sports medicine in the title, it's certainly not just for doctors, and all of these may wish to study the course. Our students have gone through the course and they've gone in various different ways. And perhaps the question might be, where might I end up after I've finished this course? What might I be able to do? And of course, the majority of them are doing clinics, and those clinics might be sports injury clinics. I did a sports medicine, sports injury clinic here at the UCLH in my NHS clinic this morning. You might be working with a team. You might be working with a professional team or an amateur team, a weekend team. You might be working with a national team. You might be doing both. You might do a clinic for a couple of days a week and you go into your team for a day or two of the week, or maybe you only go into the team at the weekend. National governing body. So the overarching body which looks after, which manages the teams for the national teams. And if that's the national hockey team or the national netball team, there is an organization who run the show, and they need doctors, and they're doctors as their chief medical officer, or they need a physio as their chief physiotherapist. They'll need a sports scientist to be their chief sports scientist. They'll be organizing the medical and science teams for the sport. They may not be the doctor or the physio, the sports scientist who is working with the athletes on the ground. They may be doing the organizing, but maybe they're doing both. Many people will end up doing some research. In fact, over the course of the program, if you're doing a master's course, you'll do a research project, and we will encourage you to try and publish it afterwards. We would certainly like you to be putting it together in a way which is publishable. And just this week, one of my students from last year told me that she's had her dissertation accepted for publication in the Asian Journal of Sport and Exercise Psychology. She's a Japanese graduate back in Japan. Some of you will be teaching sport and exercise medicine. Hara finished her degree, her MSc in Performing Arts Medicine, and she is running her course. I studied sport and exercise medicine, and here I am leading this course. In fact, all of our staff have been through an MSc in sport and exercise medicine, whether it's here or elsewhere. Some will go on to join expeditions. Last year, 2 years ago, two of our students went to Nepal, went to the Himalayas as doctors, working with a team of, they were military teams, they were with the army, going on expeditions up into the Himalayas. And so those kind of opportunities come up all the time. One of our current students runs an expedition medicine company, and she goes around the world with expeditions. She's studying sport and exercise medicine to learn how she might best manage her athletes whilst they're away. Many of you will work at events. As an example, in 6 weeks' time is the London Marathon, and the London Marathon takes over London. We will have 150 doctors. We'll have around a similar number of physiotherapists, perhaps around 100 podiatrists, all working in the medical team, in the medical tents along the course and at the finish line. You may be simply working at that event, or perhaps you're helping to organize the medical team for that event. You'll be advising, might be advising your local club, you might be advising your local council, you might be advising the government on things that are relevant, things that you've learned from your sport and exercise medicine teaching. So I guess there's lots of different places you might end up, and maybe you're doing all of those. And I put all of those there, I'll go back to them, to show actually I do all of these. No, I don't, that's not fair. I don't advise a national governing body, although I have done in the past. But I'm involved in all of these over my working week and over the year. So let's then move on to what you might learn at UCL. And the headline bit, of course, is sports injury diagnosis and management. And that, I think, is what everyone will expect to learn. But we'll go through some other things in more detail. In particular, injury prevention. Injury prevention is a big part of what we do. And that is not just managing the injuries when they happen, but working out strategies to try and prevent the injuries in the first place. And that's where you'll get the biggest bang for your buck, is preventing injuries and illness, of course. And perhaps I should have made that a little bit more specific in the presentation. Rehabilitation from injury. Once you've got an injury and you've diagnosed it and you've managed it, how do you get back to playing afterwards? How do we make sure that your athlete is stronger and more robust than they were before, so they're less likely for the same thing to happen again? We have run a module on exercise physiology, and separately another module on utilizing exercise, physical activity, as a medicine in the prevention and treatment of chronic diseases, of a multitude of chronic diseases. We'll teach you about sport and exercise medicine in a team setting and in an event setting, like the London Marathon that we mentioned. We'll teach you about the principles of research. And those of you who are doing a master's program as opposed to a postgraduate diploma will do a research project. You will have the opportunity to set up a research project from scratch if you have the desire to do so, or maybe you'll join in a research program that's ongoing and you'll participate in. But together you will collect data and write up that data in a format which is potentially publishable. That research project is a full third of your degree, and that goes on throughout your final year. How will you learn? Well, you have the options of being campus-based or distance learning. Campus-based students, as the name suggests, are here on campus at the Institute of Sport, Exercise and Health, and distance learning students are learning online. Now, those distance learning students are doing the learning whilst they're doing it online, and they are labeled flexible because of the route. In fact, forgive me for a second. Let me quickly simply say that you can study full-time, i.e. all in 1 year, or part-time over 2 years. That's half a week in the first year and half a week in the second year. Or you can study via a modular flexible route, which is 3, 4, or 5 years. Now, the vast majority of our distance learning students are modular flexible students, and they therefore choose only 1 or maybe 2 modules per term, and will take a little bit longer to do the course. And most of the distance learning students choose that route because they are perhaps still working full-time and have decided not to take a year out of their work to come and study at UCL. So they're labeled modular flexible. That mode of teaching is labeled modular flexible, but distance learning students are not, the distance learning route is not flexible in the sense that you can study when you want. It's flexible in the sense that you can choose the modules in the order that you want to choose them. But distance learning students will learn at the same pace and at the same time as the campus-based students. So all of our lectures are streamed live for our distance learning students. So you can be learning from the other side of the world if you wish, or the other side of London if you wish, on your computer. You can be watching that video. You can be watching the live stream, and you can put your hand up and you can ask the questions too. All of the lectures are recorded, and those recordings are put up online on our in-house virtual learning network, so that distance learning students can watch them at a later date and go through them at their own pace. They're also available for campus-based students to go back and spend time going through at their own pace afterwards, and for their revision and learning for the future. Distance learning students will come in at the end of each module for a day or 2 per module into London to come and learn the bits that we can't deliver online. As an example, it's very difficult to teach how to examine the knee over a video. So we will ask students doing the lower limb module to come into London at the end of the lower limb module for a day or 2 to come and learn how to examine the knee, where it will be a hands-on practical day of learning. So for every module, there'll be 1 or 2 days where you'll come into London. Actually, for every module, there'll be 1 or 2 days where you will be learning specifically, but for some of the theoretical modules, you won't need to come into London. You will be able to do that online. But for the practical modules, the sports injury modules, you will come into London. So you need to factor that into your planning. It happens at the same time. It's usually end of April, beginning of May, and we stagger the days back to back. So you're going to come in for several modules at a time. You can do them all in one go. All of the assessments are, the vast majority of the assessments can be done online if you're a distance learning student. So why should you consider studying here at UCL? Well, it's the top university in the UK for research. It's 8th in the world overall. I think that's quite impressive. If you want to learn more about it, here's the link. I expect you have already seen that if you've found your way to this talk already. You study here at the ISCH, Institute of Sport, Exercise and Health, which is an internationally recognized sports medicine center here in the very center of London. And one might call it the heart of sports medicine in London, if not the UK. And I hope it's apparent to you that your teaching staff are passionate and are expert. Of course, your teaching doesn't only happen through me and through my team of lecturers, but also a large number of guest lecturers, all of whom are experts in their particular discipline, who we will bring in when we don't have the in-house expertise to deliver that teaching. As Hara mentioned, we too have a wide range of assessments to suit all learning styles: essays, exams, multiple choice exams, individual presentations, group presentations, OSCEs, objective structured clinical examinations, vivas, pretty much that. But most of our assessments are practical in the sense that we ask you to put together something which you will be able to use outside, something which, if you're working for a team, they may ask you to produce. So for the exercise physiology, for example, we ask you to put together an exercise program for a particular athlete. In the rehabilitation module, we'll give you an athlete and an injury and ask you to put together a rehabilitation program. So everything is applied. Everything is what you may be asked to do in real life. All right, finally, what should you do next? Do ask questions. There'll be an opportunity to ask questions in a minute, and you're very welcome to ask me questions by email at a later date. If you're interested, go on a pitchside course where you can learn the pitchside management. We've taken the decision not to teach you pitchside medical treatment, because not all of you are doctors or physiotherapists. And those of you who are not doctors or physiotherapists don't need that. But if you're interested, there are pitchside courses that are available. The RFU and the FA, the Football Association, both run internationally recognized courses. If you want to work in those sports or other high-level contact sports, you'll need to do that pitchside course separately to this course. But by going on that course, you then have your eyes open to a whole wealth of additional opportunities, some of which will be to volunteer at events. Now, you may, at this point, simply volunteer as a first aider, if you have a first aid qualification. If you're a doctor or a physiotherapist, you can volunteer as a doctor or a physiotherapist. If you don't have a qualification, you may volunteer as a marshal, for example, or an administrator. But by being there, by seeing what happens, being on the other side, you'll get a good sense of what you can expect. Pay attention to the journals. There's a large number of journals, particularly British Journal of Sports Medicine, which we consider to be our home journal, the one that we're most familiar with, the one that is run by the British Association of Sport and Exercise Medicine. Look out for the electronic table of contents, subscribe to those, which means that once a month you'll get an email through saying these are the interesting papers from this month's version of the journal. listen out for podcasts, spend some time on the forums and on Twitter, where you can learn a lot of sports medicine education. Go along to some of the conferences. In October, there will be the next BASM, British Association of Sport and Exercise Medicine conference. And perhaps you've already started the course by then. We hope you will. But there'll be other conferences in the meantime where you might get to hear some sports medicine learning. Ultimately, though, we want you to come and study here at UCL, and so you need to submit an application. I'm sure you've got you've seen the application page already, but submit your application as soon as you can. All right, that's what I've talked about. You don't need that. There's my email address, and Kate will give it to you as well. And I will stop and take any questions. Kate, do you want to take over?
Fantastic. Thank you so much, Courtney, for a very excellent presentation. Hopefully a good overview that can stir on to our Q&A part of the event. So I know that we've got a couple of questions already, but please do submit those in the Q&A part, the Q&A function in Zoom. We'd love to hear from you. And if you have any questions about any of the presentations or even any academic related questions, I'm sure Courtney and Hara will be delighted to take those as well. But yeah, I'll kickstart with a question from myself, which is usually what we get a lot of questions about. And in terms of for the application, do you have any advice? Obviously, I know, Courtney, you've mentioned kind of like next steps advice, start reading journals, asking questions. But is there anything in terms of the application that you're looking for, anything that will make an applicant stand out? So perhaps, Courtney, if we go to you first, just to hand over from your last part of your presentation.
Is there anything that we're looking for? We're looking for your passion about sport and exercise medicine. We'd like to know why you want to do it. And that usually comes across very clearly in the personal statement. We're looking for what you want to do, what you want to do in the future, and how you think that this course can help you. And that is a very useful tool for us to get a sense of whether or not it's the right course for you. And for many people, for a fair number of people, I'll have a conversation with them about whether or not it's the right course, because I don't want somebody to come and spend a year or 2 years or more studying for a course which doesn't help them get to where they want to get to in the future. So if you have any questions or queries or concerns about that, please reach out to me and we can have a discussion about whether this course will be the one that will help you get a foot on the job, on the career ladder, or get you to where you want to get to in the future. So that will come across in the personal statement. One of the other things that it's important to recognize that we require is a year of postgraduate experience in your own discipline. We feel that's a very important part of what you bring to the course. You bring your experience working in the real world to the course, and you share that with your students. But not only do you share with your fellow students, not only do you share with your fellow students, it actually makes the course more meaningful to you. So we don't take people who have just qualified, who have not worked in the real world before, because they actually, we believe that they don't get the best out of the course because they haven't yet had the chance to put into action being themselves, being that clinician or that scientist in that particular discipline.
Thanks, Courtney. And Hara, I don't know if you have anything to add.
Yes, very similar to what Courtney said, Kate. Obviously, we look for the passion and we look for the interest. And I think I don't remember an application without a passionate sort of a statement, personal statement. Usually the people who apply for performing arts medicine, either they have a background themselves in performing arts, they may have been playing a musical instrument or danced or did something similar, or there's something in the family, in their background, that makes them really passionate. We have been quite flexible in a sense that, like Courtney said, we did have this postgraduate year or years of experience, because the the applications we receive, they come from a very different background. You know, there might be somebody who is a senior professional, and at some point in their career they want to do this this study to expand, you know, their field of interest. So in that case, of course, experience comes with you know, from the start. But then we have this really driven individual who has just graduated, and we may offer for them to start with a certificate, for instance, in the beginning. And if we feel that they can actually you know, get involved into the more clinical modules, then we will discuss that during the first year and upgrade them later on. So we have a little bit of flexibility in terms of helping everyone. And again, we tend to have those one-to-one Zoom meetings or face-to-face meetings, if we can, to guide people and make sure they choose the right course. I suppose that's what it is. We don't have any, you know, particular guidelines for the personal statement. Just don't go on for pages and pages. Just be, you know, a nice sort of readable 1.5 page would be more than enough. And again, you know, if we feel that there are questions that we may have, we will ask you to get in touch and we'll meet you one-to-one.
Fantastic. Thank you both. So we do have a couple of questions in the Q&A, so I'll quickly try and get through those. So the one question is, my graduation score is below 3. I'm going to apply to performing arts medicine. I received vocal health first aid training from London before. I also took vocal care training for singers, and I've been attending BAPAM's online training for the last 2 weeks. Can I apply even though my graduation score is low? So I think that's for you, Hara.
Yes, hello. If I pronounce your name well, it's Gulkan. Forgive me if that's not correctly pronounced. The applications, just for you to understand how it works with every UCL application, at least at the postgrad level that I'm familiar with, the application will come to the admissions officers. It will not come to us directly. And the admissions officers, a big department at UCL that looks at every year's you know, big numbers of applications there. They will look at what criteria have been set up. Some criteria have been set up by us as a department, and some are set by UCL as well. For example, language and undergraduate scores are standards that the UCL are quite strict about. So it is not up to us to say, oh yes, don't worry if you have a low score, we can discuss it. It is up at that first stage of application approval before it comes to the department, to us, to approve anything further. It would take a if you like, a bending of the regulations for reasons to sort of go against that criterion, I suppose. And just to be frank, that's how it would work. We have done it, but not for a big discrepancy before. So, you know, we would do it for a few percentage points. That it's quite understandable for some students. But if the discrepancy of the score is big, then I think it's not us, UCL will sort of stop the application at the initial stages. Having said that, I'm not sure exactly what you mean by that score. I don't know what equivalent to the UK scores that is, but perhaps you might want to ask this question directly to the admissions, or ask us and we can ask on your behalf, if that is something that is read in a different way from our end. So I'm not trying to discourage you. I'm just trying to say that, you know, this is something that UCL holds quite high. It's part of the, you know, the high standard of the university. So it is not, you know, something that we will bend easily, I'm afraid.
Thanks, Hara. I've also dropped a link in the chat to the prospectus page, which you can Once you go onto there, you can there's various links that will link you to admissions as well. So if you do want to contact them directly with any of these types of queries, please do. But again, if you would like to email Hara or Courtney, and then they can also direct it to the right person, that's not a problem as well.
No, it's a good time. I'm sorry to interrupt, Kate. It's a good time. It's still March. You know, if you leave it until June, July, when admissions get overwhelmed with a lot of postgraduate applications, then you might not get an answer for a while. So if you have that kind of queries, it's better to ask them, you know, ask for admissions now.
Fantastic, thank you. And we have a question from Elizabeth. So what are the entry requirements for the MSc in sports, compulsory and or advisory? So Courtney, if I hand that over to you.
Indeed, the entry requirements are that you've completed an undergraduate degree in a medical or related discipline, which includes sports science, sports rehab, and others with some discussion, that you've completed that and you've spent a year working in your own discipline after graduation, and that you meet the English language requirements if you're an international graduate. And those English language requirements are set by UCL, and I can't remember exactly what level we look for, but I think it's good overall. And there's a number of different companies which will assess and provide certification of your English language skills, and all of which are recognized by UCL. You can find those on the English language requirements page. So I mentioned the headline, the headline as your undergraduate degree, and at a certain level, which is a 2 or 1 and above. If you aren't a doctor or a physiotherapist, we will certainly look at your application and certainly consider your application alongside your personal statement, which will tell us why you want to do the degree and what you want to get out of it, where you want to get to in the future. And if you want to, we can have a conversation about whether it's the best degree for you to do, depending on your personal circumstances. And we've got lots of experience with that, and we're very happy to have those conversations.
Fantastic. Thanks, Courtney. Just having a look at the chat, as I know some questions have come through that. So we have a question from Sean. So thank you, Sean, for your question. My current undergraduate placement year is an optional full year at an exercise physiology lab, completing clinical exercise testing with various populations, ranging from elite athletes to NHS preoperative patients. This involves leading CPETs, skin fold assessments, VO2 max, and lactate threshold testing, teaching one-to-one exercise sessions, and much more. What will I need to complete in a postgraduate year that differs from this, other than it being post-graduation?
Thanks for the question, Sean. I guess there probably isn't very much difference. If what you're doing in that internship year, which I presume that's what it is, if that is working full-time in that discipline. If it's early on in the course, and therefore people who are on that intern year actually haven't done much of the studying beforehand, then perhaps there is an element of the level that we're looking for. But we're certainly happy to discuss whether or not it's appropriate. It sounds like it probably is appropriate because you've listed pretty much everything on there. If it's a full-time, we'd certainly consider it. What we would need to discuss, as I've mentioned earlier on to others, is whether or not this is still the right course for you as a sports scientist. And for some people, it is the right course because it gets them to where they want to get to. But for others, it isn't, because it doesn't get them where they want to get to. It's important to recognize that our course doesn't turn anybody into something that they're not already. So a sports scientist who does our course will still be a sports scientist at the end, just with an additional qualification. And I say that because some people apply for our course assuming it's going to let them into physiotherapy field or to apply for jobs being something different, when it doesn't. So if you're a physiotherapist and you take our course, you will be a physiotherapist with a sports medicine qualification. And it's the same if you're a doctor, same if you're a sports scientist. So if you, and this isn't necessarily directed at you, Sean, but anybody else, if you're thinking about changing your career and becoming something different, then I would encourage you to study for that discipline first, and then come back and study for a master's in sports medicine afterwards, when you're able to utilize what we have to teach you in the specific domain that you're moving into. As a sports scientist, we certainly have a handful of sports scientists on the course, and they want to do the course because it teaches them specific aspects about the way that they want to go in sports science. So if you've got a question about that, we can have a conversation about it separately another time. I hope that helps to answer some of your questions.
Thanks, Courtney. We have 2 questions in the Q&A. I'm conscious that we have 2 minutes left, so I'll just read both of them out, and then if we can just quickly try and hopefully cover them. But equally, please do contact Courtney and Hara following today's event as well. We'll drop their emails in the chat. But just to cover those 2 questions, so do graduates receive employment from ISEH? And then the other one is basically that they saw online that the reference requirement for the MSc PG Dip Sport Medicine, basically they're saying because of the pandemic they weren't able to get a chance to connect much with their professors, but could they use their employer as a reference since they are currently a physical therapist? So yeah, we'll just stick with those 2 for now. So Courtney, do you want to?
So Kate, we do require an academic reference, but even if you didn't connect with your professors, they will still have your academic record to refer back to, and that's routinely what they refer to in the references that we get. So do ask your professors, do ask somebody from your course to be a referee, and they will do so. I know I get students ask me to do it all the time. So you can do so, and we will accept it, even if your pandemic teaching during the pandemic meant you weren't connected. Separately, ISEH doesn't offer employment, but if there are job opportunities, then you'll be very welcome to apply. Javier, you mentioned that you are interested in elite sports, but you didn't mention that in your application. No, that's not a problem. If you said you're interested in managing sports injuries, that's what we want to know. It doesn't matter whether it's in football or the general population. We'll teach you everything. Tell you why.
Thanks, Courtney. We do have a question. I think it's in the Q&A for you, Courtney. Again, it may be worth though. I don't know if you could type the answer as a reply, because it seems
no is the answer, because it is, if that's from KJ about radiology, that's a conversation. So
yes, and there's also one from Javier as well that's in the Q&A. But I think actually it may be best, these are fantastic questions, and what we can do, I'll just drop Courtney and Hara's email address in the chat. So if you could please email them this, that would be fantastic, because I know obviously with the time sensitive, we don't want to rush getting back to you when we don't have to, if we can set you all up to email them directly. So I'll just pop them in the chat. But thank you so much everyone for all the questions. They've been fantastic. I'll just put in, so the first email is Courtney, so that's c.kips@ucl.ac.uk, and the second email is for Hara, so that's hara.truly@ucl.ac.uk, and please do contact them with these questions. Courtney and Hara are both very happy to answer those as well. So unfortunately we're out of time, and I'm sorry if we weren't able to get to everybody's questions, but we just wanted to say thank you so much for coming to today's event. We do have a quick survey, so we'd really appreciate your feedback about today's session. It should pop up on your screen following today's event. If you have any further questions, again, we'd just like to reiterate, please do contact our speakers directly by email. Apologies to those that we weren't able to get around to your questions today, but I know that Courtney and Hara will be happy to address those by email. And thank you so much for all your comments and questions. And again, thank you so much to our speakers for another fantastic and excellent session. And we hope to see you at UCL, and have a lovely evening, everyone. Take care.
Thanks so much. Thanks, Kate. Thanks everyone for participating. Goodbye.
Thank you.